I'm a second year nursing student at the collaborative program for that Ryerson. I'm at the Centennial site, finishing off my second year.
I'm a student from the Occupational Therapist Assistant and Physiotherapist Assistant program at Centennial College.
My name is Deandra Granville Anderson, and I am enrolled as a student at Centennial in Healthcare Environmental Services Management.
So my name is Natasha Lawrence. I'm in the first year of the Nutrition and Food Service Management program at Centennial College.
My name is Mehnur, or you can call me MK, that's fine as well. I'm in the PSW program, which is the Personal Support Worker program at Centennial.
What is your role in infection prevention and control practices?
So my role as a nursing student is to be educated on every guideline that is out there for our own personal safety as well as the safety of others. That includes making sure that you're always on PPE, making sure that you follow any guidelines as required by the placement that you're in, and keeping up to date with what is happening the outside as well. And I know in my placement, there were very good guidelines set as to responsibilities that students can do versus the nurses versus the other healthcare workers at the facility. And all we had to do was go online their website and then kind of stated what was required of us as well. You know, the nurses were really approachable, telling us what we can and can't do. So they were always a good source to go to when you know what you're not supposed to do or what you're supposed to do and what your responsibilities are.
So my role as a student in infection prevention and control practices is using hand hygiene before and after seeing clients. Along with that, disinfecting any equipment and surfaces that we use for treatment, and following contact, droplet, and airborne precautions.
Okay, so as HESM, which is the acronym we so popularly use to, abbreviate healthcare environmental, the course, our role is to ensure primarily that the healthcare environment is clean and disinfected. And I say clean and disinfected to distinguish between the two because there is such a vast difference. Cleaning refers to generally ensuring that, the area is free of dust and debris. But when you go into disinfection and sanitization, you're trying to either eliminate all the microbes or to minimize them to a safe level. So that is why I made sure to emphasize that difference. So that is our role as HESM in infection prevention and control. We're ensuring that the environment is clean and disinfected.
I'd like to start off with handling food. So it's very important that before we handle food that we wash our hands. So there is a procedure to washing our hands. A lot of us think, okay, we go to the sink, we put a little soap and we spend like 5 or maybe 7 seconds washing our hands, but that's actually not enough. So we should be washing our hands for at least 15 seconds. So you can even, recite the ABCs or something like that. So you would wash the top of your hands underneath your fingernails with warm water. And then you would dry your hands well, or you would use like a hot air blow dryer to dry your hands. Now, if sink washing is not available, if a sink is not available for you to wash your hands, then you could use hand sanitizer, but you have to make sure that the hand sanitizer is at least 70% alcohol to 90% alcohol. So I actually have a few samples here. So I have this one here that is 70% alcohol, and it says it right on the label. So this is one that you'd want to use. I have another one that it smells really nice, but when you actually look at the back in the ingredients, it's only 62% alcohol. So it's not quite what you need. And then I have a little bottle here that actually in the ingredients doesn't tell you the percentage of alcohol at all. So you may want to steer clear of those ones. So also too, when you use hand sanitizer, don't handle food right away. Give it a few minutes before you handle food, or again, try to wash your hands. It's the best way to prevent infection and cross-contamination.
I think being a personal support worker, we're the people that are very, very close to the patients, and we often have the most contact with the patients, where they're with them constantly, more than the nurses, more than the doctors, where their eyes and their ears. And so with that being said, we're dealing with often a lot of patients at once. And so something very important is to kind of make sure that it doesn't spread with us. Since we're very close in proximity, we have a greater chance, I would say, of contracting the pathogen for ourselves and then spreading it around. And so in a healthcare environment, it's our duty to prevent that from happening. And I think the biggest thing that we can do to help that and just breaking the chain of infection in general is starting with ourselves first. And that involves trying to take care of yourself and building up your own immune system. And so that can involve me eating nutritional food, staying physically active, trying not to smoke, just getting exercise and building up your own immune system so that you are at a lesser risk for infection. And then just after that, having proper hand hygiene, taking a bath, wearing clean clothes, clean socks, keeping your nails short and tidy. So all these things that we do for our own hygiene are actually also going to help us prevent the spread to others as well, which I think is very important and something that people tend to forget. It starts with yourself.
What is one key tip for students related to infection prevention and control practices?
Definitely be mindful of the information that is available to you. Mindful in the sense that go out of your way to look for it. Mm-hmm. It might not always be given to you, and don't hesitate to ask anybody who's working there full time just to get a quick scope of your responsibilities at the end of the day. And your CI is always a good source to go to. And they've actually really helped me saying like what our responsibilities are and aren't. But yeah, overall, don't hesitate to ask any of the staff.
So this is something I learned the hard way in placement, and that's to keep your hands moisturized, because hand washing and alcohol-based rubs really dry out your hands. So use lotion.
As a healthcare, as a member of the healthcare team, it's everybody's business. We have to work together in order to minimize or ultimately eliminate the possibilities of having, these microbes being transmitted. So I want us to remember that we have to work as a team, and each member of our team is important. The nurses are important, the doctors are important, the healthcare environmental services workers are very important. So we all work together to ensure that at the end of the day, our patients are kept safe and they're done so in the best environment that will help them to have, live a healthy lifestyle.
I would say that no matter where you are, whether you're at home preparing food or whether you are at work or you're at someone's house, always practice good hygiene. Wash your hands for at least 15 seconds, dry them properly, use proper hand sanitizer. So it's very important to just continue it in your everyday life, whatever you do. When you practice safely, then it just becomes natural. It comes naturally to you. So that when you are in the workplace and you have to follow the standards, then there's no worries. Oh, I forgot to do this, because you would just naturally go and you would just naturally follow the standards.
Being in the program and kind of looking at the dangers and the way they can be prevented by such a simple act like hand washing. If there's one thing I can say, is that it is the most important thing in infection prevention control. And so washing your hands is extremely important. And it's the most important part of medical sepsis. And as healthcare workers, we practice that to prevent the spread of illnesses and infections. And it's our responsibility. And this is the least we can do.